Guys, welcome back to my channel. It's been a while, but I'm back, and today I would love us to talk about urinary tract infections, what we commonly refer to as UTIs. But before we get down to business, if you're new here or if you haven't yet subscribed to my channel, kindly hit on the subscription button down there and also help me share the video. So a UTI is a bacterial infection of the urinary system, and when you're talking of the urinary system, you're referring to the kidneys, the ureters, the bladder, and the urethra. So the kidneys are responsible for excretion of waste products as well as excess fluids. So what normally happens is that urine is formed in the kidneys, then it gets down through the ureters, it's stored in the bladder, and finally it's released through the urethra. So for an individual to acquire a UTI, normally bacteria from the enovage gets lodged into the urethra. Then this bacteria ascends into the bladder, and at this point an individual may experience signs and symptoms of a UTI. So if this individual isn't treated, the bacteria will further ascend into the ureters and finally into the kidneys. So the most common causative bacteria of a UTI is E.coli. However, we still have other bacteria that can bring about a UTI, but the most common one is the E.coli. So let's look at the predisposing factors of a UTI. One of them is a female gender. When we talk of the female gender, we are looking at the fact that a female's urethra is shorter compared to that of a male, and this means that bacteria will have a shorter distance to travel from the urethra to the bladder. And then the fact that a female's urethra is also close to the anal region also puts her at a risk of developing a UTI. Another predisposing factor is pregnancy. During pregnancy, there are several hormones that are normally released, and these hormones normally bring about physiological changes in a female's body. And this puts her at a risk of developing a UTI. And also the fact that during the second and the third trimester, the fetus keeps growing, it presses on the bladder, and this can bring about incomplete emptying of the bladder. And we know that urine is a good media for bacterial multiplication. So if urine is not completely emptied, or some urine remains in the bladder, this will encourage multiplication of bacteria, and this will put one at a risk of developing a UTI. So another predisposing factor is male infants who are born with a congenital abnormality that we refer to as posterior urethral valves, and these normally interfere with the normal flow of urine in an infant, and this can put them at a risk of developing a UTI. However, these congenital abnormality can be corrected. So another predisposing factor is individuals who have a catheter in situ. So these are individuals who are not able to pass urine normally due to one reason or another, so there's need for them to have a catheter inserted. So if this catheter isn't changed frequently, this individual will be at a risk of developing a UTI. Another thing is individuals who take long to pass urine, and this can be maybe due to the fact that where they are working, they are not comfortable with the washroom, so they prefer to hold urine until they are at a more comfortable place. So this is wrong, because the more you keep holding urine, the more you encourage bacterial multiplication. So another predisposing factor is blockage in the urinary system, which can be brought about by either kidney stones, urethral strictures, or individuals who have a condition that we normally refer to as benign prostate hypertrophy, which is enlargement of the prostate gland, which is common in males who are 60 years and above. So something else is individuals who have reduced immunity, which can be due to certain conditions like diabetes. We also have cancer patients, and we also have HIV positive clients. Another predisposing factor is females who use certain birth control methods like spermicides and diaphragms. So these will interfere, or these normally interfere with the normal flora, and you know that the normal flora helps to keep off or to head off bacteria. Something else is not practicing proper hygiene, or not performing proper hygiene practices. For example, females who clean themselves from back to front instead of the other way around, front to back. So this will encourage bacteria to invade the urethra, or the bacteria from the anal region to invade the urethra. So it's important to clean yourself in the right way, that is from front to back. Yeah, so what are the signs and the symptoms of a UTI? So one of them is pain in the lower abdomen. We also have lower back pain. We have pain while passing urine, or burning sensation while passing urine. We also have frequent passage of urine. Some individuals may have foul smelling urine, or they may pass foul smelling urine or cloudy urine, or even urine that has red blood cells, which is what we normally refer to as hematuria. So if this infection has ascended into the kidneys, this individual may experience pain on the flanks, or the region that is just below the rib cage. You also have fever, you have chills, vomiting. Yeah, and for infants or babies who are not able to express themselves, yeah, they may present with fever, crying a lot, irritability, and some may even have urine incontinence. Yeah. So if you experience either of the signs and symptoms, visit your doctor. Yeah, so that they may perform certain tests. And the main test, or majorly the test that we normally perform to ascertain if you have a UTI, is urinalysis or urine analysis. So the doctor performs these tests to find out if your urine has bacteria or pus cells in it. So if the diagnosis is made, it'll be treated with antibiotics. And the choice of the antibiotics depends on the severity of the condition. So the individuals will be treated with 5-day course antibiotics, 7-day course antibiotics, 2 weeks, and the individuals will even be admitted so that they can receive intravenous treatment, yeah, depending on how severe the infection is. The non-pharmacological management of a UTI, the main thing is drinking plenty of fluids. When you're talking of fluids, you're referring to, could be water, can be juice, porridge, tea. So the main thing here is frequent passage of urine, because the more you pass urine, the more you flush out the bacteria. Yeah, you also encourage to drink, to eat fresh fruits and vegetables, and this will help to build up your immunity, and it will also hasten healing. Yeah, so for mothers who have babies who are using potties, it's advisable to clean them after every use. Yeah, so that you avoid you avoid putting your baby at a risk of developing a UTI. Yeah, so some studies also show that cranberry juice helps to reduce the risk of a UTI. There's something that I didn't talk about, which is complications of a UTI. So one of them is pyelonephritis, which is infection of the kidneys. So if this individual was not treated well, the infection was still localized at the bladder and the infection ascends into the kidneys, this is a complication of a UTI. We also have renal failure, which can come about if this individual is still not treated. So there is pyelonephritis and this individual hasn't received treatment. There is also a risk of developing renal failure. And so if an individual develops renal failure, they may need to have dialysis, because like we talked, or like I told you during the introduction of the topic, the kidneys are responsible for excretion of waste products as well as excess fluids. So if these kidneys are failed and they are not able to perform their normal function, it means that this individual may need to be undergoing dialysis so that these excess fluids and waste products are excreted from the body. Yeah, so some individuals may also need to undergo renal transplant. So another complication is septicemia, which is a life-threatening blood infection. So this individual may need to be admitted, or rather will need to be admitted for them to be treated for this life-threatening complication. Yeah, so majorly that's what I had for you today. So if you develop either of the signs and symptoms, kindly visit your doctor. Don't treat yourself. Don't go to the chemist and buy over-the-counter drugs, because some signs and symptoms are normally similar, or rather various diseases present with similar signs and symptoms. For example, an STI or a pelvic inflammatory disease, those diseases may have some signs and symptoms that are similar to those of a UTI. So you can be treating the wrong thing. So the best thing is to visit your doctor. They run tests on you, and then they're able to make the correct diagnosis and the correct management. Yeah, so guys, thanks a lot for watching. I hope you've enjoyed the video. I hope you've learned. If you have something that you'd like to add, if you have any query, or if you have a topic that you'd like us to discuss, kindly hit my inbox. Yeah, so thank you very much. See you in the next.